So we're going to be going over 6-month supine. It's a DNS position. It also looks a lot like happy baby if you've done yoga before. And it's really good at helping increase core stability, but it's also a really good way passively using good belly breathing to be able to get good expansion in our low back. That's going to bring a lot more blood flow, decompress our low back. Really good if we're in an early phase of some sort of low back injury or just low back muscles are super duper tight. It's really good at relaxing and kind of resetting that area. So first, the passive version. So we are gonna lay on our back here and have something underneath your head. For me, I have this table here. It's slightly inclined. The reason being is we want to keep our chin kind of tucked here. We don't want our chin coming up. So if you have a little bit more of, let's say, a rounded upper spine where that's going to happen a little easier, you can bring like a pillow or something to kind of go underneath here. That's going to make this position more successful. And then for the passive version, we're going to grab our feet here where our knees kind of come up a little bit more towards our chest. If you can't grab your feet for whatever reason, you can grab your legs here or even your pants if you're wearing some pants long enough for that. And then here you can kind of notice that the lower part of my back, kind of my sacrum area, is off the ground. That's perfect because we want to be mostly on our mid part of our back and our shoulder blades here and then the back of our head. And now with a really relaxed belly, we're going to take a nice breath in through our belt line here. So this breath is super important. If our belly is relaxed, we can get the proper expansion using our diaphragm and our belly pressure here. And that breath in itself is going to help lengthen the spine and decompress it and relax all those low back muscles. The number I want you to think of is 30, because that's the amount of breaths that it sometimes takes to be able to have really effective breathing here to really reset and relax things. Okay, now the active version. So again, instead of us, it's easy to use this, I guess, to get set up, but then instead of us holding here, we're gonna have to hold our legs this way. And then instead of just doing the regular belly breathing, I want you to keep your belly pressed out into your belt line. And then you're going to slowly move here. If you notice, I'm fighting for my life right now. And you're almost going to do windshield wiper movements. If you might have noticed, as I was going, my sacrum started coming down and almost touched the table. So in order to keep this positioning really effective, you can put maybe it's another like little pillow or something kind of right there where your sacrum is, that lower part of your spine, because that'll help us load through that mid back and make this more of an effective core exercise. And then again, slowly windshield wiper to the left and to the right. And less is more here. I want to make sure we're keeping positioning. Another thing too is I want to make sure that my shoulder blades are equally on the ground. Sometimes if we start to go one way, so here it's my left, my right shoulder blade comes off and I start to rotate with it. So I want to make sure I'm not doing that. And then you can just do this. I usually like to just set a timer for about a minute or so per round and do a few rounds like that, where I'm not really counting reps, because sometimes when it comes to counting reps is we get more caught up on the quantity of the movement instead of the quality. And right here, quality is everything. So I'd rather you set a timer for a much shorter amount of time and have that be more intentional than larger dosage where the quality isn't quite there. So that is DNS 6-month supine.